Hi, I'm Dr. Neftali Serrano, a primary care psychologist. I've worked alongside many physicians in primary care clinics, and one of the most common problems I've seen patients have, both young and old, is the problem of panic attacks. It's one of the strangest and scariest of feelings when you feel like your body is completely out of control. You start breathing heavily, your heart starts to pound. You may feel strange sensations in different parts of your body, like tingling or numbness. And of course, the one thing you're thinking is, I'm going to die right here of a heart attack or stroke. Well, the good news is that you're not likely to die of either as a result of a panic attack, because a panic attack is very different altogether. If you give me a few minutes today, I'll tell you why, and I'll let you know how you can begin to make things better. Here's what we'll cover, and then you can discuss treatment options with your primary care provider. 1. Thinking better. Understanding what panic disorder really is crucial to managing it. 2. Feeling better. A simple breathing exercise and strategy for relaxation. 3. Staying better. We'll discuss medication options. Let me describe to you what is actually happening to you when you experience a panic attack. It is not a problem with your heart, and it is not a problem with your brain, as in the case of a stroke, but a problem of the lines of communication of your body, or what's called your nervous system. Now, when our nervous system becomes agitated, sometimes due to chronic stress or a variety of other factors, it can begin sending incorrect signals to different parts of your body, such as your heart and lungs. Think about it this way. Sometimes when there's a storm outside of your home, the telephone lines are affected, which makes your phone relatively, unusable. Now, what's not working here? The phone or the telephone lines? Of course, there's nothing wrong with the phone itself. It's just that the wires are not working right. Well, it's the same thing with your nervous system. Your nervous system is sending bad signals to your heart, lungs, and other parts of your body. It's telling your heart to beat fast, your lungs to breathe faster and more shallow, and other parts to feel things that they really shouldn't be feeling. Now, believe me, you're not making it up. It's just that your nervous system is really upset. Now, the good news again is that there's nothing wrong with those parts of your body, only the nervous system, which connects all of your body to your brain. So you can rest assured that unless you have a pre-existing heart problem, that is a problem with your heart muscles or the veins and arteries related to your heart, you won't face heart difficulties caused by an attack. This is also good news because there are some natural ways to give your nervous system a hand to get back and stay at a more normal state of relaxation. Now, believe it or not, you're already doing something that is good for your nervous system, that is learning about what is actually going on with your body. Often what makes an attack worse is that when we first start feeling symptoms, our thinking gets more and more extreme, and we try to control what we feel with our thoughts, which in the end only makes things worse. We might think things like, oh no, not again, I can't let this happen to me, not here, not now. Oh, this feels horrible, I think I'm going to die, I've got to stop it, I've got to get out of here. Well, when we think thoughts like this, our nervous system gets naturally more upset, because in the end, you're only fighting yourself. It's a funny thing to think about, but the truth is that controlling what you feel with that kind of thinking just doesn't work. So, step 1 in dealing with an attack is changing the way you talk to yourself when you first start feeling symptoms, so that you stop fighting yourself. I call this baby talk. Here's something what it looks like. Oh my. Okay, my nervous system is upset again. I know what this is. It's going to be okay, body. It's going to be okay. I remember what the doctor told me. These are just feelings my nervous system is creating because it's upset. It'll last just a few minutes and then things will calm down. I'm going to start my breathing exercise and I'll be okay. The idea is to talk to yourself the way you would a baby that's upset. This will help your nervous system calm itself down. It's a more accepting, patient approach. Don't underestimate how important this is in managing an attack. The good thing is that as you have more success with managing attacks, your ability to manage them increases, and you begin to cut down on the length and the severity of the attacks. Now, the second step. Once you soothe yourself with baby talk, you can begin a simple breathing exercise which helps to naturally ratchet down your nervous system. The reason it works is because it activates a part of your nervous system whose job it is to calm the whole system down. Here, I'll show you. Now, when you have a panic attack, you breathe this way, which of course doesn't give you enough air to breathe because it's too shallow and too fast. It just goes in and out, in and out. To return your breathing to normal, you can do the following exercise. First, you place one hand on your belly button. This is to help make sure you're breathing correctly. If you're breathing correctly, you should feel your hand move slightly in and out from right around your belly button. A good way of doing this is to imagine that you have a balloon you're inflating underneath your hand. You breathe in through your nose and out through your mouth, following this pattern that I'll show you. Inflate that balloon and hold it for a moment, and slowly breathe out. Then you count to 5, breathing normally. 1, 2, 3, 4, 5. Breathing normally again. 1, 2, 3, 4, 5. Now, you do this as many times as it takes to feel more in control, but be patient and don't feel surprised if when you do it you feel a little bit lightheaded or dizzy, especially at first. This can sometimes indicate that you're breathing too quickly, which is why we count to 5 in between the deep breaths, or that your body is just not used to this form of breathing yet. This exercise is so helpful, I recommend practicing it 3 times a day, perhaps one at breakfast, once at lunch, and once at dinner. By practicing it frequently, you can begin relaxing your nervous system throughout the day, therefore also working towards preventing another attack, and also getting better at the exercise, which helps to shorten future attacks. The final step, medication. Medication may also be an option to discuss with your doctor, especially if you've had attacks for more than a few months on a frequent basis. The safest and healthiest medications your doctor can use are called SSRIs, or as they are more commonly known, antidepressants. These medications are not addictive, which means you won't get hooked on them no matter how hard you try, and they are safe and effective over the long term. I hope you don't feel poorly about yourself if you need to take one. There's no reason to. As we've already discussed, it's your nervous system that's out of whack, which means there's a physical reason for this problem. So it makes sense that a medication would be helpful. The medication helps strengthen the nervous system by giving it more of the neurotransmitters or natural body chemicals that it needs to function properly. Kind of like making sure your car has enough oil or gas. As with anything, patience is key. Most SSRIs don't take full effect until about 4 to 6 weeks after taking them, although many people say they feel somewhat better after 2 to 4 weeks. Talk to your doctor about the right SSRI for you. Now, in rare cases, your doctor may elect to give you an anxiety medication that works right away. These medications are much less recommended because they can cause addiction, and in some cases can make the symptoms worse over the long run. They also tend to be sedating, which also deprives you of the opportunity to learn on your own how to manage an attack. So the best approach is to try an SSRI. Now, if you decide with your doctor that taking one of these other drugs is necessary, use it only when absolutely necessary and talk to your doctor immediately about a plan of use and a plan for discontinuation. Now, medication can be an important and healthy part of your strategy for managing panic disorder over the long run. Now, there are other aspects which may help as well, such as seeking help from a psychologist who can help you understand what may be triggering your nervous system to become so agitated and assist you with making life changes that may help. Talk to your doctor about recommended behavioral health providers. Well, I wish you the best as you make your way back to a more relaxed state. Research shows that you have a great chance of getting your nervous system back to normal. So be encouraged and talk to your doctor. I'm Dr. Neftali Serrano.